So I found out I was having a baby, and I already admired just how personable you are. You know, I showed up at the hospital and you asked me if I wanted to augment labor, if I wanted to wait for the process, and I appreciated that I had a choice in you know, what kind of care I wanted while at the hospital. Yeah, I just enjoyed just being able to have a baby and know that I was in good hands throughout the whole process, that I could trust in you, that every medical decision that was made was in good hands.
And it was just a lot of fun because we got along well before, and it was just, you know, it's a cool thing to be growing a baby and be able to watch you grow in your mama's belly, and then not ratting out that you were a girl, even though I did know, but I said I didn't know. So it could be a surprise for mommy and daddy.
I was just really honestly praying for a happy, healthy baby. I was just fortunate to know that I just felt like the whole time I was in good hands, so I didn't feel like I needed to make a step-by-step birth plan. But I think that it worked out because of a great team too, from the delivering provider to the midwife that was there to my laboring nurse. I think it's neat because at St. Mary's they work so well together as a team and make you feel like you're well taken care of.
And I think that's important too, that it was a conversation. Like we knew each other, we felt comfortable chatting. And
we laughed a little, like who laughs during labor? I don't know.
Who laughs birthing a baby?
Cheers to an epidural.
Exactly. And you felt comfortable to speak up. If something wasn't going as you wanted, you could say, hey, I want the lights brighter. I want to get in the tub, you know, whatever.
Yes, absolutely. I was also excited because I think I was fearful of not wanting to be induced, and I think you honored that, which I loved, is that, you know what, it'll happen when it happens. And we had days planned, but she had her own days planned. And she actually was born on her due date. Go Dr. White.
It never happens. You can't be born on your birthday. For me, I want to know what's important to you in labor, and some folks have preconceived notions, and I like to joke around about it a little bit too, and saying, you know, the biggest thing for me on a birth plan is to look through and make sure I want a birth hanging off a chandelier is not on there. And if there's anything that's atypical or, you know, that's very specific, that we can go over that in advance so there's no surprises for anybody.
Right.
And it's just, it's fun. It's your birth experience. It's, you know, it's your baby, and this is precious cargo, and how it gets here is important too. It's important.
Right. So. Yes. And I was able to have a healthy, stable labor and delivery, and I think that's all a mom really wants.